Good afternoon, everyone, from the World Health Organization headquarters in Geneva. It's Wednesday, 5 p.m., and it's time for us to answer your questions about COVID-19. I'm joined by Dr. Mike Ryan and Dr. Maria Van Kerkhove as usual. And today, as we've been receiving a lot of questions about the new COVID-19 virus variants, we will be taking questions on this subject. And if you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, leave your questions via comments section. Good afternoon, Mike, Maria. Thank you for your time today. And while we're waiting for viewers to send their new questions, what I found already that we received is about the variants. Maybe we can start with what do we know at the moment about the new variants, where are they spreading, how much are they spreading, and what are we doing?
Sure, so can I first start by saying happy birthday?
Thank you.
So it's Alex's birthday, and so we just want to wish you a very, very happy birthday. And thanks for having us and doing this on your birthday.
Thank you. Pleasure.
So now down to your question. So it's a big question that you ask about these virus variants. So if we could break it down a little bit, maybe, because I've been getting a lot of questions on these as well. And these virus variants are changes in the virus. And normally when a virus circulates, it changes, and there are mutations. And these are changes in the genetic sequence when it replicates. And when you have a virus variant, you may have more than one mutation. So a number of countries are tracking changes in the virus over time, and they have identified these virus variants that people have heard about. There are a couple that we are tracking right now. The first one was identified in the United Kingdom, and this virus variant has a number of mutations and changes in the virus itself. And when there's any change in a virus, you need to ask several questions. What does this mean? What does it mean in terms of transmission? Does it transmit more easily? Does it transmit faster? Does it cause a change in the way that the disease presents in terms of the symptoms and signs and symptoms people have? Does it cause more severe disease or more death? And then we also want to know, does the virus variant change our ability to detect it with diagnostics? Does it change our ability to treat it with therapeutics? And will it have any impact on vaccines? So if we break it down in different elements of it, the first thing is around transmission and transmissibility. So there's a virus variant that has been identified in the United Kingdom. There's a separate virus variant that's been identified in South Africa. We know it's different because it has a different combination of mutations, and we can tell by comparing the sequences. There are other variants that we are tracking in Brazil, and there have been variants and mutations we've been tracking since the beginning. The first one that we identified was called the D614G. If people have been watching our press conferences, they've probably heard us say that. And that was a single mutation. And that virus was first detected at the end of January, early February. And by June, it was the dominant strain that was circulating around the world. And this is what happens. Viruses want to become more fit, and they want to transmit and infect more people. The variant in the United Kingdom, there is work that's being done to understand how it transmits, and there's a suggestion from the data, from the analysis, that it does transmit more readily than the other SARS-CoV-2 viruses that are circulating. And we know this through some epidemiologic analysis and modeling. And it's an increase in transmission from like around 1.1 reproduction number to about 1.5. And that sounds really scary, and it's not good that you have increased transmissibility, but we can still see in these countries where this virus is circulating that transmission is reduced with public health and social measures that are in place. And then in South Africa, this variant that's been identified in South Africa is called 501YV2. You can stop me if I'm talking too much because it's so much information, and if I'm not being clear, please stop me, Alex, sure, okay? Because it is a lot. It is a lot to cover. So in South Africa, South African researchers identified this virus variant because in 2020, they increased their sequencing capacity across the country. It's an incredible achievement. And this virus variant is circulating in a number of areas in South Africa, and it's replaced other viruses that were circulating, other SARS-CoV-2 viruses that were circulating there. And both the South African, the variant identified in South Africa and the variant identified in the United Kingdom do not seem to present differently in terms of disease. But in the United Kingdom, recently we have seen some results that suggest that there may be an increase in mortality for people who are infected with this variant compared to other viruses. But the data is very preliminary, and there's a lot of caveats around the announcement that the United Kingdom made the other day about this. The risk of death is still low, but there is a suggestion from some of the analysis that they've done that there may be increased severity. But there's a lot of work that's being done, and there are scientists all over the world that are working directly with us to help us understand. It's science in real time. It's studies that are being done in real time.
Thank you, Maria. You mentioned the code for each of these strains. So I'm curious, how do you name them? How do you give them this code? Because they have different numbers, different letters. So I couldn't catch any similarity. So how does that work?
So there are different nomenclatures. There's different ways that these viruses and variants are named. There are three main nomenclatures right now for SARS-CoV-2, and we are working with those three groups to come away with a common naming system. It's too complicated at the moment. In the United Kingdom, you have variant of concern 2020-1201. In South Africa, they call their virus variant 501YV2, and in Brazil, they call their virus variant P1. It's too confusing to speak about, and there are these three systems in place. So we have called a meeting with these three groups and with a few others to come away with one common naming system, so that we don't actually have to name every variant that's of interest, but we do need to name the ones that are important, the ones that have a potential impact on severity, on transmission, and any of them that have any impact on therapeutics and vaccines. The virus variants that have been detected to date do not seem to have an impact on the vaccines that are in development right now, and that's good news. Again, it's preliminary information that we have, but it's really important that the viewers understand that the vaccines will still work against these virus variants. But there is a system, we have to have a very strong system in place to track them over time and study them, because there may be a point where that may be different. So we need to be in a good place where we're working with all of our partners to study them properly. But the naming is something that we will work to fix very soon, because I struggle to actually describe them myself, and I'm sure the viewers find it very difficult to follow all of these different names.
There is a comment, if I may read from Sahil Kumar: hard to understand so many biomedical terms, need a simple explanation about the COVID new strain.
Okay, we'll try.
Yeah.
I said it here, I said it before. In a sense, imagine, I'm going to use a sports analogy, right?
Oh, no.
You're going to kill me. But imagine we're in the second half of the game, we've finished the year, and the opposition has just introduced a substitute or some replacements on the other side. They have a burst of energy, they're a little fitter, they're a little faster. Now, we have a choice to make. We can either decide, oh, that's it, we've lost the game, there's nothing we can do, or we can actually analyze, what does that mean? Do we throw our game plan out the window and start all over again? Or do we look at our game plan, look at the behavior of the other team and adjust and adapt what we need to adapt and move on? And teams that win are the teams that are able to not panic when the other team makes a change. The rules of the game haven't changed. What's happened is essentially that the opposition player has just made itself a little fitter and faster, and we need to react to that. This happens. This is viruses evolve. They just change. We change. That's how we've developed as a species. We are able. Every unique individual that's born is born with a set of attributes that are different to all previous human beings. Sometimes we're a bit taller, a bit stronger, a bit wiser, we hope, a bit kinder. But all of our traits, all of our physical and mental traits and others, are driven by our genetics and the environment in which we live, and the two interact, even within humans. the environment actually affects the expression of our genes. So in that sense, we're the same biologic entities as viruses are. As Maria said in the past, though, viruses are unique in that they cannot live outside the host. They must immediately find another host, and they must infect a human cell. So it's a desperate and they have a very short time to get from A to B, to get from one human being to the next. So therefore it's a big race, and there are millions of viruses in that race, literally billions, right? So the ones that get there faster and the ones that get there in more numbers are more likely to be successful. So it's a game of numbers. If I am able as a virus, if my proteins can bind to the human cell more effectively, stick more effectively, if more of my family of viruses, more of my particular mutation or more of my strain can bind, therefore I'm just more successful. And then I invade more cells. And then I make the person make more virus. And that person's virus level will be higher. And in that situation, that individual is then more likely to transmit to the next individual, which means I won the race. With all my virus pals, I got there first, and I did a more successful job. And that's what we mean by being fitter. As the viruses evolve, some of the mutations don't suit the virus. In fact, most of the mutations are detrimental to the virus. It's a lottery for the virus too. Most of these changes are random. And what happens is natural selection, in a sense. The evolutionary pressure is that those viruses that evolve, that have an advantage, survive, and they replace the other viruses. One variant replaces the other. And in that sense, we now have an adversary, or multiple adversaries, that we have to keep a very close eye on. And that's what Maria said. The most important thing is that we have a risk management approach, that we know where they are, we track them, we understand how they're transmitting, we understand if they're more severe, we understand if they're affecting our diagnostics or our therapeutics, or whether they're affecting our vaccines. And even down the line, let's imagine, not at the moment, we have no evidence thus far that the vaccines will be any less effective. But that can happen. Look at influenza. We change the vaccine composition twice a year for the northern and southern hemisphere. And we're able to issue vaccines very, very quickly to combat the predominant flu strains every year. So there's no reason, even down the line, if this virus evolves to a point where our vaccines begin to lose effectiveness, we can adapt those vaccines. And I believe we can adapt those vaccines quickly. So the real power we need right now is knowledge and information. If we don't know what changes are happening, then we don't have the ability to make the changes we need to make. So now the job right now is really hardcore monitoring, track this virus. And then on the side of the community out there, the real challenge, I think for everyone, is the less chances we give this virus. As I said, it's the race from person to person. Doesn't matter how good the virus is, if it can't find the other person, it dies. So we break the chain. And the more of those chains we break, the less chance we have of variants emerging. And I think that's going to be, it's back to collective responsibility. It's not just the job of the scientists, it's not just the job of the vaccine makers, it's not just the job of the government. We all have a chance to beat the virus and its variants by doing exactly the same things as we've been doing for the last year, but just doing it more carefully, more consistently, and encouraging each other to do that. So we always expected variations in the virus. No one wants to have to deal with a more complicated situation, but we're ready for it, and I believe we're seeing success in many countries now in being able to, at least if we look at the situation in Denmark, Denmark was able to contain its variant very quickly, and South Africa, and again I would say in case of South Africa, a shout out to them. I mean, the sophistication of their ability to both diagnose and track this variant is incredible. And again, they're giving a gift to the world because they're demonstrating that you can track these things, you can find them, and you can monitor them, and then you can go after these variants and hopefully suppress them.
Jangan lupa like dan subscribe.